Carpal tunnel release surgery is a breeze, especially if you know what to expect. I've worked for the past 6 years in orthopedics as a physician assistant in a hand and upper extremity practice. I'll use my combined experience as a surgical PA, as well as my personal experience having had endoscopic carpal tunnel release surgery 3 days ago. I'll take you through what to expect from surgery to recovery. The first thing you need to do in preparation for surgery is to schedule a pre-op exam. Usually your surgical team will help you schedule this. The second thing I'd like to discuss are logistics relating to work and transportation. All of our patients receive anesthesia, so they are not safe to drive themselves home after surgery. Therefore, you'll need to arrange for someone to bring you to the surgery center, bring you home, and monitor you for complications for 24 hours after the procedure. For patients who are working, most can expect a rapid return to work. Discuss the specific nature of your job with your medical provider and determine in advance when a safe return to work date would be. The third topic of preparation is preparing your home. We'll start with the 3 essentials: eating, sleeping, and hygiene, and then we'll quickly cover everything else. Resuming your regular activities after carpal tunnel surgery is relatively simple. There will be just a few things that you'll struggle with for only the first couple of days, and those do include meal preparation and eating. Keep in mind you'll have a small dressing that your surgeon will ask you to keep clean for the first several days. For our patients, we ask that they keep the dressing clean and dry for the first 3 days after surgery. So to make it easier for yourself in the kitchen, think simple. Simple to open, simple to prepare, simple to eat, and simple to clean. A couple of tips include buying pre-cut produce and avoiding meals that require heavy pots and pans. Sleeping usually isn't a problem after surgery. Rearrange your bed so that you have a few pillows available to elevate your hand, and practice getting in and out of the bed without putting any pressure in your palm. Most people just use their forearm instead. So for hygiene, we're talking about showering, using the toilet, and washing your hands. My best advice would be to get a large bag that will cover your hand and your dressing and keep it dry while you're doing these things. Throughout the day, you can use sanitizer on your fingers, but for showering or for any unexpected emergencies, it's really helpful to have a bag available to cover your arm. From personal experience, after my surgery, my husband left for a few minutes to get some groceries, and during that time, my daughter had a spill and I had to react very quickly and get her cleaned up in the bath. I don't know what I would have done without the large bag that I had purchased in advance to help protect my dressing. I went to a local store where they sell farm goods, and they have vet sleeves, also known as artificial insemination gloves. I was able to purchase a 10-pack of those large plastic sleeves for about $4, which was very affordable, and I was very grateful to have them around in that circumstance. Alternatives, if you don't want to use that type of bag, you could use bread bags, garbage bags, or other devices you have around the house, and you can secure them on your upper arm with tape or a rubber band. Alternatively, you can skip showering altogether for the first 3 days, or you could do bird bath style, which is essentially using a soapy washcloth to wash the remainder of your body, and then just excluding your surgical site. Now everything gets easier after you're allowed to remove the bandages. For our patients, after the first 3 days, we allow them to remove the ACE wrap bandage and the white gauze pads. Then what you'll have remaining are some adhesive strips called steri-strips, and you may see some of the blue suture coming out of the skin. At that point forward, they can get their hand wet in the shower and wet for washing hands, but we ask that you don't soak the hand. This includes dirty dishwater, bathtubs, hot tubs, pools, and lakes. So showers are all right, running water over the hand, but no submerging the hand while the sutures remain in any type of water or other solution that could potentially contaminate the site. Then, if the steri-strips remain on, cover the site with a large Band-Aid to keep it protected. If the strips come off early, that's okay. That does happen sometimes, but be extra mindful to make sure that the suture doesn't catch on anything and pull out of the skin before the skin is healed. So let's summarize the information into a complete list of things that you may want to buy 1 week before surgery. Number 1, I would have you purchase 1 or 2 ice packs to keep the swelling down after surgery. Number 2, a large bag to put over your hand for showers or washing dishes. Number 3, large Band-Aids, and maybe even a 1.5 or 2-inch ACE wrap or Coban self-sticking wrap for support, especially if you are heading back to work in a few days after surgery, or you just want more protection or support around your wrist once you're allowed to remove the dressings. And number 4, groceries. Simple to prepare, simple to eat, and simple to clean. Let's conclude with a list of the top 3 things that you can do the night before surgery. Number 1, enjoy your dinner, but nothing to eat or drink after midnight the night before your surgery. Number 2, simple accommodations that you can make in your home, such as squeezing out the shampoo into a small container so that you'll be able to scoop the shampoo out with one hand when you take a shower with the other hand protected in a bag. Or even I would have you look at your medication caps. So often they're secured with the child-proof cap. If you take that off in advance and flip it over, you can secure them with a simple twist. Number 3, your attire for the day of surgery. Loose-fitting clothing from top to bottom. Wear an oversized shirt with either large sleeves or short sleeves so that you can be sure that you're able to slide your arm through. A lot of people come in an oversized sweatshirt, but they have a really small band at the wrist and they struggle. Elastic waist pants or skirt and slip-on shoes will also make things easier. You're gonna go home with a numb hand. Your hand will be numb for several hours until the numbing agent wears off, so it's gonna be difficult for you to get dressed unless you make it easy. Thank you for watching and good luck with your upcoming surgery. Look for more videos on my page, PA Lara and Ortho Hacks. This information is not intended to be a substitute for a thorough conversation with your medical provider. Even with the best surgical team, a safe, successful experience starts with you.